Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, videos, courses, one on one sessions, and more to assist nurses and nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder that I always like to go over is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions you see here, I have created and designed based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number one states a patient presents to the office today for follow up. His blood pressure is 124 over 80. He denies any past medical history. What is the best treatment at this time? Is it A, chlorothalidone, B, lisinopril, C, lifestyle modifications, or D, amlodipine? Take a moment and tell me what you got, you guys. All right, you guys. So, I always recommend reading the stem of the question first. Stem of the question being that last question with the question mark on it, because it allows you to slow down to ensure you're answering what's being asked. This pinpoints what the question actually is, right? So here it states, what is the best treatment at this time, right? So you know what I always tell you. If they're asking for a treatment, you need to run it back and see what the diagnosis is, see if they have provided one, and if they have not provided you with the diagnosis, you need to run it back a step further and look at the assessment findings so you can come up with the diagnosis, right? So here, this patient is just here for follow-up. Blood pressure is 124 over 80. He doesn't have any past medical history. So how should we treat this patient? So we know 124 over 80 is not terrible, right? But what it is leading into an issue potentially, right? Because that goal that we set is to be less than 120 over 80, right? So if they exceed, then we need to start to incorporate lifestyle modifications to prevent them from going into a diagnosis of hypertension, right? This is considered pre-hypertension according to ACC and AHA guidelines. So for testing purposes, if you have a patient with this and they're starting to exceed by any measure greater than 120 over 80, you want to incorporate lifestyle modifications. Lifestyle modifications for hypertension being the DASH diet and exercising with moderate exercise 5 days a week for 30 minutes each of those days. Or if they're doing high intensity exercises, then you want to do they can do that just for 75 minutes, and break that down however works best for them. All right, question number two. The patient is returning to the office for a 3-month follow-up. He started his lifestyle modifications, including the DASH diet and exercising 5 days a week for 30 minutes. His blood pressure today is 136 over 82. What is the best treatment at this time? All right, so the patient has come back. He was 124, um, and he's back in the office for a 3-month follow up. He has been doing the lifestyle modification, so he's doing all the right steps, but blood pressure today is 136 over 82. So, what is the best treatment at this time? Are we going to A, initiate chlorothalidone, B, initiate lisinopril, C, continue lifestyle modifications, or D, initiate amlodipine? Take a moment and tell me what you got in the comments. So, stem of the question, what is the best treatment at this time? So, again, this person is back. He's returned to the office for a 3-month follow up, because we were in that pre hypertension stage. He's back for 3 months, been doing the lifestyle modification as recommended, but his blood pressure today is even higher at 136 over 82. So, what are you going to do? Are you going to initiate chlorothalidone, lisinopril, amlodipine, or continue the lifestyle modifications? So, following ACC and AHA guidelines, we're going to see continue the lifestyle modifications, and I'll tell you why. So, this patient was prehypertensive, but remember, he had no past medical history, right? And so, he's still not exceeding that goal range of less than 140 over 90. that requires treatment for those who don't have comorbidities, right? Like any other medical history of diabetes, chronic kidney disease, hyperlipidemia, whatever. He doesn't have any past medical history. So we want to continue those lifestyle modifications and continue to follow him to ensure that we can get this down to where it needs to be. Okay. All right. And question number 3. The patient returns to the office for a 1-month follow up. His blood pressure today is 144/92. What is the best treatment at this time? Are we going to initiate chlorothalidone, initiate lisinopril, continue the lifestyle modifications, or initiate amlodipine? Take a moment and tell me what you got in the comments. All right, so stem of the question here. What is the best treatment at this time? All right, so the patient is back. Again, 1-month follow-up. Blood pressure is even higher. Over one is 144/92. So here, that's exceeding that top range, right? So even the healthy population, if you exceed 140/90, we need to initiate with medications. You'll continue the lifestyle modification, but now it's time to incorporate medicines, right? And so here, this patient doesn't have any allergies. It doesn't have any medical history of like diabetes or chronic kidney disease that is warranting that we are doing any renal protective medications. Um, it does not tell us any ethnicity for any specificity of medications that we need to utilize. So, we think of all of our first line therapy, our thiazides, our calcium channel blockers, our ACEs, our ARBs, but thiazides are the top of that list. So, your best answer here is A, to initiate chlorothalidone. Okay. So I just wanted to give this to you in a different scenario so that you can see it all the way through. Because when I'm doing sessions with review students, a lot of my one-on-one reviewers get tangled up with, okay, if they're healthy, you do this, and what is goal, and what does that look like in a question? And so I wanted to kind of give it to you in different scenarios to see it, and I'll keep incorporating this, but make sure you know the goals, know ACC and AHA guidelines. If you struggle with it, go check out my hypertension video where I talk through and walk you through those to kind of help you so that you can know first when to incorporate treatment and then what type of treatment, because that's the big thing with this. You have to be able to initially identify when you should treat and then how to treat that population with what. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. And if you need any of the resources that I offer, feel free to reach out to the Nursing Studio at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. Things that I offer, I have a review book that you can get the ebook or paperback option. Both are linked in the bio of this channel. I offer a self-paced review for family and adult gero for both exams. It's also linked in the bio of this channel. Our 5-week group review is coming up in September again. And then lastly, the one-on-one sessions. And I always say, because the one-on-one sessions are customized, just give us a call or shoot us an email so we can gauge what you truly need, okay? But as always, make sure y'all meet me back here. Happy studying. Bye, y'all.